Welcome to the Penn State College of Medicine Project ECHO session. We're delighted to have you join us for this first session in our COVID-19 ECHO series. My name is Jackie Sable. I'm a member of the ECHO team, and I'll be facilitating today's session. A few announcements before we begin. If you've not already done so, please put your name, email address, and affiliation in the chat box. Please stay muted unless you're speaking. But I will mention, with the number of connections that we have, we may need to rely mainly on chat for questions and discussion, but our ECHO team will be monitoring this, so no worries. Please remember that there is no personally identifiable information allowed when we discuss cases, and we are recording these sessions. For those of you who are new to Project ECHO, it's a healthcare initiative that originated at the University of New Mexico as a means of equipping communities with the right knowledge at the right place at the right time in addressing a hepatitis C challenge. It's an all teach, all learn, interactive, guided practice model of peer-to-peer learning and collaborative problem solving. And we'll be capitalizing on that model today to address COVID-19 challenges. I need to thank Dr. Jen Krasniewski, who's the medical director for Project ECHO at Penn State, for her vision in leading our ECHO efforts. In the spirit of all teach, all learn, we'll be on a first name basis during our sessions. Our ECHO sessions will always begin with a brief lecture, followed by a case discussion. Cases include some sort of a question or challenge that you want to address and are a critical component of our ECHO model. So we really encourage you to submit cases that can be related to your patients, to preparedness, to policy, whatever challenges you're experiencing and where you would like to generate more discussion and ideas. You should have already received a link to our case submission form, and we'll be resending that again throughout the series. For our first session, we're thrilled to have Dr. Gavin Macgregor-Skinner provide a brief lecture related to personal protective equipment. During his lecture, please feel free to put your questions into the chat. We'll be monitoring that again. And in addition to Gavin, we have a team of specialists from Penn State online, and they'll be fielding questions as well. But remember, this is an all teach, all learn model, so anyone can share both questions and answers. After the lecture, I'll share a great case discussion question that was submitted by Matthew Yu. He's the medical director for Northside Christian Health Center. Thank you, Matthew, for being the first one to submit a case. It is a great question, and I'm sure Gavin is going to have a lot of input on it. And I do want to recognize briefly, I think we have a slide that lists the panel of specialists that we have coming in from Penn State Health. So we have a great team. Not all of these individuals will be on all of our calls. Their schedules may be quite hectic, as you can imagine. We actually had some people already that were called out to meetings and are not able to be here. But put your questions, put your discussion items into our chat. We're going to monitor it. And if there are things that we don't get addressed, we will certainly be following up via email. And with that, we're going to stop sharing and we're going to pass things over to Gavin, and he has a great lecture prepared for us.
Thanks, everyone. Welcome to our Penn State Project ECHO presentation for this morning. I'm going to talk to you about recommendations for protecting your eyes, nose, and mouth, and how to optimize supplies for coronavirus disease 2019 or COVID 2019. A lot of what I'm presenting actually comes from published documents by different US government agencies, but also a lot of what I'm talking about this morning comes from personal experience. And I really want to emphasize what we're trying to do at Penn State is open up a platform, a dialogue, where we're in a situation where it's not quite normal. This is quite unusual for what we're doing at the moment in our hospitals, for our frontline health workers, and what we're doing as a community in its entirety. So we opened up a platform where we can start sharing stories, sharing best practices, and also answer questions. And remember, you know, all of us who teach at Penn State, every question is a good question. If that's your concern, if that's what you're worried about, if that's something you just don't know, if we don't know the answer, then we're going to reach out to this huge network of experts that we have at Penn State, and we'll get that answer for you. And we'll make sure that answer is the best evidence-based answer that we can provide to you. I'm going to talk about protecting your eyes, your nose, and your mouth. Why? Because we know that the coronavirus that causes COVID-19 disease causes respiratory infections, and we need to protect our face, our eyes, our nose, and our mouth. And I call that protecting our holes. I need to ensure, though, that everything I say today has to be interpreted where you work. It's based on what you do. Where you work, you have access to a lot of subject matter experts that can help you with making decisions. So any legal decision you make on your own, because you know the government regulations, you know the legislation, you know state and local regulations. So even when I make suggestions, we also have to make sure that we meet whatever legislation or rules that we need to follow. I want you to start understanding that you need to do your own risk assessment. In the training that I do in hospitals throughout the country and in other countries overseas, I want people to start doing personal risk assessments. You need, in every situation you go to, you need to be able to identify the hazards, the threats, the viral load, the expected viral load. You need to understand that for this particular virus, I need to protect my eyes, my nose, and my mouth. And every time, wherever you are, whether it's in the hospital or in the community, you need to slow things down and do your own risk assessment. It's really important right now that we consider what we're facing. We're seeing the number of cases that increased overseas in other countries. We have learnt those lessons from countries where we've seen healthcare systems go and have been taken to an extreme where the resources are limited. Today, I want to talk about how to prevent shortages. What do we do to prevent exhausting our very limited supply of face masks, respirators, eye protection, but also to ensure that the staff that we work with have access to the necessary equipment to do their job safely. And again, the work that I do focuses on frontline workers' safety, hospital staff safety. I'm there to help you protect yourself from being infected because the job you do is so critical. Reusing N95 respirators. This is not a new topic for us, for any of us. Well, maybe for some of you it is. But in 2006, the Institute of Medicine published a document, The Reusability of Face Masks During an Influenza Pandemic. This document is available for free download from the website, the Institute of Medicine website. But I want to emphasize too that many of us that work in hospitals, we've been through this. We've been thinking about this for years of how do we extend and reuse face masks, but what other improvisation can we bring into a hospital setting where we think we might be at threat of having virus go into our eyes, our nose and mouth, and what other ways we can protect ourselves. And it's very important because I found a similar situation in 2014. I had 3 trips to West Africa where I set up and managed hospital staff as well as assisted with supportive care to patients with Ebola. We were very, very restricted with these limited resources: face masks, personal protective equipment, face shields, eye protection, and we had to manage them properly. The challenge we had in the US was that we were waiting for the US government to produce documents that we would then have to read, interpret, and operationalize. And right now, we can go back to our medical training of first principles of infection prevention and control, and understand how whatever situation we find ourselves in, we can help our staff protect their eyes, nose, and mouth. I'm going to talk to you today about personal protection, and specifically, I'm going to talk to you about 4 types of personal protection equipment: a face shield, eye protection, goggles, glasses. For Ebola in 2014, we even wore ski masks that we reused over and over again by cleaning and disinfecting from the time we went into the hospital, from the time we came out of the hospital, but at least we had some sort of protection on our eyes. I'm going to talk to you about respirators, and especially about face masks, surgical masks, procedural masks, but N95 respirators. I'm going to talk to you about what they can and can't do and how we could possibly extend their use or reuse. And I'll also talk to you today about powered air purifying respirators, or PAPRs. And here's a situation I wear most of the time if I'm in a hostile environment with a high viral load. I'm concerned of what I might be exposed to. If I have my PAPR with me and I have my own PAPR, I'll put it on. And this particular PAPR I'm wearing here in a training situation, I've had this for 3 years. You'll see the 3 green lights at the top of the hood there. That tells me my battery's working. It tells me the computer chip in the hood in the helmet is working. It also tells me my HEPA filter is working. And I find those HEPA filters in my PAPR, they last for months. My battery life on a PAPR that I'm wearing, like this one I'm wearing at the moment, it has a 10-hour battery life. It works on positive pressure with air coming down over my face to keep out virus particles. I really want to emphasize though, it's not just the personal protective equipment. And this series of photos here on this slide are from a workshop in Tennessee, where I was telling them, you need to protect your eyes, your nose, and your mouth. And so what the hospital staff here, the physicians, the doctors, the specialists, the nurses, the EMT, the ambulance drivers, any other paramedics that could have close contact, they brought all their equipment to this workshop and we made it work. We had 34 different combinations of personal protective equipment that were able to help the hospital staff write their own standard operating procedures to ensure that they could put on, don, and take off, doff, and do it safely to decrease the risk of infection. So I know that a lot of what you've got now, you may not look like the photos from CDC, but at least you've got something in your hospitals now that we can work with to write standard operating procedures to ensure that people understand how to use appropriately and to protect and lower and decrease risk. And it's very important as we talk not just about personal protective equipment, not just to talk about the limited supply of N95s, or we don't have access to a PAPR, or we don't have this. We also have administrative controls, standard operating procedures, and engineering controls. And it's very important now where we are focusing on effective, the best patient care that we can give to patients that have a respiratory infection that might progress to severe pneumonia, that need both breathing support, fluid support, nutritional support, emotional support, that we also, within where we work in our hospitals, we also focus on the administrative and engineering controls. What do we have in our buildings that can help protect spread of the virus? What administratively do we have? Our surveillance programs, our training, our standard operating procedure compliance programs, evaluating and validating our standard operating procedures, our training through standard operating procedures and protocols, ensuring that people understand. And the way that I do this in a training situation is I teach one, then they have to teach me back. And I find that any person that can teach me what I've taught them, then they have a better understanding of what they're trying to do. Today, I'm going to talk about 2 definitions where we have limited resources. Extended use, where we'll wear the same N95 respirator for multiple encounters with patients. The second definition is reuse, wearing the same N95 respirator for multiple encounters with patients, but removing or doffing between some of those encounters, whether it be for food, nutrition, a bathroom break, or as I find sometimes when I wear a N95, if it's a 1 hour or a 2 hour, I've just had enough. I need a break. I'm exhausted. The guiding principles that I really want you to understand that we're going to focus on is that whenever we put the personal protective equipment, if we keep taking it off and putting it on and reusing it, we're increasing a level of risk. Extended use is preferred over reuse. Reuse by a single person. And that means with the limited supplies of some of the personal protective equipment we have, there's no sharing. We have to identify the certain equipment we're going to reuse, and it's used for one person only. We don't share it between shifts. We do not, and I repeat, we do not ever use N95 respirators after aerosol generating procedures, or if they're damaged, or if they're moist or wet. And as we focus on patient care, and I have a lot of COVID-19, some that have had home care and they feel absolutely awful, and some can get out of bed and some can't get out of bed, and others that have been in hospital and have their symptoms have increased and gone to severe pneumonia where they require breathing support. We need to come up and use tools that we have to learn patients and staff, because every time we as hospitals, we come out, we have to take off the equipment. Let's look at ways that we can communicate better with our patient. I want to start on full face shields. Again, here's an example in this photo of a full face shield. It's one per person. You put your name on it so you know it's yours. If you need to reuse, you need to ensure you clean it and then you disinfect it. The EPA registered disinfectants for SARS-CoV-2 virus, the virus that causes the coronavirus disease or COVID-19, need the disinfectants that are listed on the EPA website, and that website is there. They are not effective. They do not work on dirty surfaces. You need to clean first to allow the chemistry of the product in the disinfectant to work on the piece of equipment. Also, when you go to this website, you're listed on that website. It will say contact time. That is the wet contact time. And I'll emphasize now, any wipes that you're using, any disinfectant that you're using, let's start reading the labels. And on the back of those labels, it will say, you need a wet contact time of 5 minutes, or you need a wet contact of 10 minutes. That means you need to thoroughly wet the equipment or the surface and allow it to be wet for that period of time. If we need to clean residues, then we clean it off after that contact time and we clean off the residue. But again, I reuse my face shields for many infectious disease outbreaks. When we've run out, we've made our own. We've got sheets of plastic, we've cut them out, we've used Velcro, we've used other material to secure them safely to our head, and we've made our own. And I can't emphasize enough, this is one way that we can put around our face any time of the day to protect our eyes, nose, and mouth. Eye protection. Again, eye protection, it's goggles, glasses. Again, I've used ski masks for Ebola disease. It's one per person. Again, you clean and disinfect. The disinfectant won't work on dirty surfaces. Do I reuse these? In an ideal, perfect situation, no. But right now, yes, I do. And I'm using them going into hospitals. I come out, I take them off safely, I clean and disinfect them, and I put them on a surface that is also clean. I'm going to talk more about that, but I make sure that I allow them to dry and I reuse them. In situations, and I find it myself in a lot of situations where I may not have my eye protection, I might have other spectacles or glasses. The other day I was in a situation where I had no eye protection, but I had a pair of sunglasses. I put my pair of sunglasses on. That gave me, it wasn't perfect, but it gave me some protection for my eyes. N95 respirator. Extended use is preferred over reuse. At no time do you touch the outside or the inside of your N95. You can touch the yellow straps and you take it off by pulling it up over your head, but you don't touch the front or the inside of your N95. Again, we can continue to wear, for extended use, an N95 respirator when we do a shift. For me personally, I find that I might be able to wear this for 2 hours, but I'm pretty exhausted after 2 hours in N95. I find as the shift increases, if I have to work more hours, that level of time, it becomes less. So there's times where I might be only able to wear my N95 for 1 hour or 45 minutes because I find breathing through it difficult. If we're managing rosters, if we're managing our critical frontline health workers, we need to ensure we listen to their concerns about wearing an N95. If I'm the manager, the supervisor of the shift, and I tell someone to go in and work for 2 hours and they say, but what happens? We have to have a system where we signal with our hands or the way we communicate. I need to come out and have a break. Or someone might say to me, look, I tried to wear it yesterday for 2 hours, but I really found I was really struggling and I wasn't focusing. I'm really worried if I feel fatigue or I can't focus, I'm going to make a mistake. We then manage our staff appropriately based on how long they can wear one of these N95s. Every year, for those of us that work on the front line in hospitals, we've gone through a system of fit testing, through the Occupational Safety and Health Administration, OSHA requirements, where all of us on our staff have needed a medical clearance. We've done a fit testing test, which can be both quantitative and qualitative with an N95. Again, PAPRs are excluded from fit testing. And then we've had some sort of regular or annual training. Right now, we're in a situation where OSHA has now said that as of March 14th, that those regulations can be suspended for fit testing. And I'm going to outline what that means for you. But I also want to really emphasize, we are putting nurses, doctors, and other administrative staff, auxiliary staff in a hospital setting for the very first time wearing an N95 and telling them to go into a hostile environment where there may be a viral load and they may be exposed to virus. Training has to happen. Even with limited resources, you have to ensure all your staff can put this on safely, they feel comfortable wearing it. Don't ever, please, don't put someone on for the very first time into an N95 and expect them to go and provide effective, safe patient care. So when OSHA suspended the N95 annual fit testing, that just happened this week, March 14th, 2020. It said in the notice that OSHA sent out, everyone needs to make a good faith effort to ensure that the N95 fits properly and it does its job as it's designed to do. You only use respirators that have been certified on the National Institute for Occupational Health, the Occupational Safety and Health site, the NIOSH site. So again, become familiar with that site. Again, we can send out links for that. As an employer, you need to inform if you change any of these requirements in writing. So everyone that works for you in the hospital, if you're going to do away with fit testing, you need to tell everyone. You need to explain to everyone that they need to understand there are ways we can train. We have videos that we can do it in person. I did a training the other day in a hospital in the car park. We can explain that there's ways of putting it on, ways of taking it off, but there's also what's called the user seal check. And every time you put on an N95 mask in any situation, you need to do a user seal check to ensure that it fits properly. That user seal check, and none of us really look at the piece of paper that comes from the manufacturer in our N95 box. Or if we look at our eye protection, there's an actual a piece of paper from the manufacturer there. When you look at the box of your N95 mask, there might be 20 N95 masks in that box. There's a manufacturer sheet. On that manufacturer sheet, it will explain to you how to do a user seal check. A user seal check must be performed each time you put on a respirator. To do that, it's both a positive pressure check and a negative pressure seal check. You put on your N95, you put both your hands over the N95, and you gently exhale to see if the face piece bulges slightly, but you also want to make sure no air escapes out the side. So you want to ensure that that seal, the integrity of that seal still works. In the photo with the negative pressure seal check, I want to emphasize, still put your hands over your face. So keep your hands over your face on your mask. And again, wash your hands with soap and water. I usually put on clean gloves. So when I'm doing this, I'll have clean gloves on my hands and I'll be doing my user seal check. And I'll take a quick deep breath to see if the face piece collapses, and the respirator will collapse slightly, but I shouldn't feel any air rush in from the sides. And that's it. It takes me about 5 seconds to do a user seal check. And if you've been wearing N95s as long as I have and you haven't started doing this, do it. If you've been doing it and you haven't been able to teach or show how to do it to others, start being a buddy, use the buddy system and start teaching others that this is very important to ensure that we have a good seal on an N95. The other thing I do when I wear personal protective equipment is I use a mirror. So you put your N95 on, put all your other personal protection equipment on, and look at yourself in a mirror to make sure it looks proper, and it fits properly. Also ask someone else, but if I ask someone else, I still use a mirror to make sure my mask fits properly. There's a lot of conversation out there right now about how do we extend that use, or how do we actually reuse N95 respirators? And I want to quickly go through the procedure that I use when I'm doffing, and that's when taking off this respirator. Knowing that I have to take off this respirator, on a normal day, I would dispose of it properly and throw it away. Now I'm going to put it somewhere and store it safely so I can reuse it. In the patient's room, I remove my gown and I remove gloves. I perform hand hygiene. I exit the patient room and put on clean gloves. I remove my face shield and any eye protection. Then disinfect. And I might use a microbial germicidal wipe. Again, instruction of the pack that I use for a germ wipe says I must keep that surface wet with an EPA registered disinfectant, observing the manufacturer's contact time. How long does it need to stay wet? Mask on. Remove my N95 respirator. Again, I'll wash my hands between the fingers, the thumb, in between the thumb and the nails, and I'll wash my hands, and it may take even longer than 20 seconds. After I complete all the doffing steps, I then store my face shield and eye protection for reuse. And I'm going to show you what I use. There's other methods out there, but again, this is a platform. We're using the Penn State Echo platform to share experiences and stories. The storage, after we remove it, you need to visually inspect it. Is it still in a condition with no damage, no distortion in its shape or form that you can reuse? If it's contaminated or wet, you can't reuse it. If it's, and again, if you don't think that when you put it on a second time you'll get a good seal, you can't reuse it. If it's not visibly contaminated, if there's no change in shape, if it's not wet, then you need to store it in a well-ventilated area. I'm going to show you how I do that. You can use a disposable N95, can be worn for several hours, again, if it meets this criteria. But again, I want to emphasize, follow the CDC and NIOSH guidelines. We do not reuse, and I personally don't reuse N95s if I'm involved in any aerosol generating procedure. Again, the process to reuse your disposable N95, and I'm going to show you how I store it. Donning it, I perform hand hygiene. I put my gown, my gloves, my Tyvek suit. Again, I want to emphasize, not everyone's going to have a gown or a Tyvek suit at the moment. I improvise. What other waterproof clothes do I have? Well, I have a waterproof jacket and I have waterproof pants. And if I'm out visiting, doing contact tracing in the community, or I'm at a drive-through testing site, I don't want to waste the Tyvek suits or the gowns that I want to use in hospital. I will put on my waterproof jacket, my waterproof pants, knowing that I can clean and disinfect that when I finish, but knowing that that waterproof material acts as a barrier. Put your gloves on, your gown and gloves on, put your N95 on. Again, do the user seal check. Perform hand hygiene, positive, negative, user seal check as I outlined. If it's not a tight seal, if you're concerned, everyone needs the ability to speak up. You need to tell someone. Don't just assume that because you've been told by someone in the hospital to go do your job. If that mask doesn't fit, then ask for help. And again, put on your face shield and your eye protection as well. If you work in a situation where you have access to a powered air purifying respirator or a PAPR, you follow the manufacturer guidelines for cleaning, disinfection, and storage of that PAPR. The model here, the mannequin here, shows a PAPR with a hood or a shroud. Again, you follow the manufacturer's guidelines for cleaning it. You can use EPA registered germicidal wipes, which are already labeled, some of them with that they're effective, or they can inactivate human coronavirus. Again, you clean and disinfect. You wipe the hood inside first, then outside. And again, you place your PAPR in a clean area and you let it dry. So I make sure I follow the manufacturer guidelines for wet contact time. It may be 4 minutes, 5 minutes, or 10 minutes. I follow the guidelines on the product that I'm using, allow the chemistry of the product to use, and then I let it dry. If I'm worried about any residue, I then clean that off. But again, I've been wearing PAPRs now for years. This particular one is over 3 years old. I wear it all the time. I have a beard, so I don't wear an N95. I prefer, and I have my own, I wear a PAPR. So again, if you have PAPRs, ensure that you're using them properly, you're following the manufacturer's instructions. What do we do in a situation where we have a symptomatic patient that's coughing? We know that virus will spread from coughing. We know the virus will spread when they talk. We know even virus particles will come out when they breathe. But we're standing there trying to provide appropriate patient care and treatment for that patient, but we may not have anything. Then we need to put a mask on a patient. And I can tell you right now, I've put procedure masks on patients. I've even put face shields. If I have a face shield, I put a face shield on a patient where they can still see, we can still talk, and if they cough into that face shield, the particles are going to be caught by the face shield, or to some degree, and it's not perfect, we don't work in a perfect world, but to some degree by the mask, the procedure mask. There are risks. There are risks of extended use and reuse. We are concerned with coronavirus, COVID-19 disease of contact transmission. Protect your eyes, your nose, your mouth, your face. The hands. Why are we telling everyone to wash their hands for 20 seconds and do it properly? Because we touch so many objects. We know the virus survives outside the body on surfaces. When you touch things, you've got to keep those hands away from your face. We know that as we reuse, for example, an N95, there is a reduction in the respirator's ability to protect. And we do that through visual inspection of that N95. We also know that extended use, long periods, hours, periods of time can cause additional discomfort. I know personally, if I put my N95 on, if I'm getting up to whether it be 45 minutes, 1 hour, or even if I'm going to push myself for 2 hours, I'm exhausted and I find it really, really uncomfortable. And again, as you look at your administrative controls in your hospital, have the ability for people to communicate and talk about how they're feeling when they're wearing an N95. Here's just one example of what I do for my personal protective equipment storage that I use to protect my eyes, my nose, and my mouth. When I take off my face shield, I don't want to put it on a surface that hasn't been cleaned and disinfected. So I'm seeing some hospitals will take off a face shield, they'll spend the time cleaning and disinfecting a surface before they lay the face shield on that surface. I often don't have the time to do that. So I'll use a bag, I'll hang it up. And this is just a brown paper bag. It provides an area where it's open, it can breathe. I've got an area where I've got air circulating, and I will put my name on it. Here's the front, here's the back. I'll put my name on it. This is my bag. No one else uses my bag. And I'll take my N95 off and I'll put it over one of the handles. What I'll also do is when I take my face shield off and I've cleaned and disinfected that, I'll hang it over the other handle. Face shield, N95 is now separated. Here's my eye protection. I've cleaned and disinfected my eye protection. It needs to dry now. I hang it inside my bag and I'll leave it there to dry. And then I'll have my bag where in the hospital somewhere safe. We've identified rooms for that, anti-rooms that have storage facilities, and we keep our bags separated. I've seen other hospitals put clotheslines up or hanging areas, and they'll hang them up with pegs or other areas to do that. There's lots of ways to do this. Again, we can discuss this and talk about what you're trying to do, but this is one method that I'm using. Everyone that works on my team, everyone that I train, start building up this culture, this ability, this behavior of taking your temperature twice a day. All of us should know what our normal body temperature is in the morning and what our normal body temperature is in the evening, and many of us don't. So I carry a thermometer with me at all times. I can provide guidelines on how to clean and disinfect that thermometer. Again, it's pretty simple, but we can provide guidelines through Project Echo to do that, to help you with. But it's really important that you start monitoring the temperature of everyone on your team, because you'll find they're all different. And you'll find that they'll vary. And if we're looking for a 1 or 2 degree temperature range, and we say, oh, it should be over 100, or it should be this, it's not. When I start monitoring my team and I see any sort of increase in temperature, I'm going to pick up and I'm going to talk to them. If I call them on phone or what happened this morning? Oh, I went for a run, I did this. There's ways your temperature changes. So start getting into the practice. Everyone who works on the front line, take your temperature twice a day, have it recorded, and have someone monitor those and look at them every day. I want to emphasize, we practice. We practice, we train all the time. Why do we train so much? To maintain competency in the critical use of using personal protective equipment correctly. One-time training is not enough. This is a photo taken recently where we were working with hospital staff as well as journalists, because we wanted to ensure that the journalists could work with the hospital staff and get the stories out there, the needs, but also the journalists were helping us capture our training videos so we could share them with a wider community. Remember that personal protective equipment itself can create a hazard. There's a lot of people that have worn it, like myself and others that worn it for years. We're comfortable with it. We know when we need to take it off when we become fatigued and unsafe. Many people have not worn this. They need to start wearing it away from the hospital, outside an area where there may be viral load, in a safe environment. Understand the limitations on vision, walking, movement, and you do get hot. The heat does build up when you put on your personal protective equipment. So understand how we need to be hydrated. We need to manage our nutritional intake, as well as manage those bathroom breaks as well. We need to come up with innovative solutions for that. So I just want to finish off that a lot of what I've gone over today does come from US government organizations like the CDC, NIOSH, OSHA, EPA. They are published on these websites, and I've provided the links today for you to go on and see those website links. The unfortunate or the challenging thing we have with these websites is they're all written in English, and they're pages and pages of information, and it takes a long time to read through them. What we're trying to set up at Penn State through Project ECHO, we'll do the heavy lifting. We'll read the documents for you, and then we'll share our best practices with you, and we'll also hear and share your lessons learned and your experiences. Thanks, everyone.
Thank you, Gavin. That was awesome. And while we have your expertise here, before we wrap up, I think we have a lot of questions to follow up on, and we will. So if we did not address your question, please consider putting it in as a case, as brief or as detailed as possible. That will help us group them and prioritize them for future discussions. But Gavin, here are a few questions that perhaps you can answer real quickly before we wrap up. If I wear personal glasses for vision, how can I disinfect them throughout the day?
Yeah, good question, Jackie. Again, soap and water. Soap will inactivate this virus. If you need to know the chemistry of how it does, I can send you that, but soap and water does work. Wash them thoroughly, set them aside to dry. Again, you may find you can clean them with soap and water. You may be able to use an EPA registered disinfectant that doesn't damage them. Call the optometrist and ask, I've got these glasses, if I use this disinfectant, will it harm? Can I use it? So again, it's possible.
Perfect. And another quick one, I hope. Can the N95 mask be disinfected using UV?
Yeah, so there's a lot of discussion about UVC light. We're seeing some hospitals where they're hanging up their personal protective equipment in rooms and putting UVC light on it. The best information I have now for everyone, Jackie, right now is that UVC light needs about 60 minutes of direct light contact time to inactivate this coronavirus. As I get more information, we'll share it.
Perfect, thank you. And one last one, if you don't mind. The rest we'll follow up with afterwards. Are digital forehead thermometers accurate enough and or fine for monitoring temperatures for people on the front line?
Yes and no. When I went to Hong Kong to help with the Hong Kong hospitals there, a lot of people were using the no-touch technology, the thermal thermometers. We love no-touch technology in hospitals. But the problem was the thermometers hadn't been calibrated. And I was in one situation where someone in a hospital said, and this was in degrees Celsius, you're 34.5, you're healthy, off you go. I went, no, I'm not, I'm hypothermic. I'm below 35 degrees Celsius, I'm hypothermic. He said, no, you're fine. And we said, you've got to understand the limitations. These devices need to be calibrated, but they also need to be checked and validated throughout the day to ensure they're still working properly.
Perfect. Thank you so much.